Mutilating children's bodies and sterilising them is fine, according to those making up the rules followed by LGBTIQA+ child gender clinics right here in Australia. World Professional Association for Transgender Health documents, sensationally leaked this week to the New York Post, reveal that the organisation is, quote, controlled by gender ideologues who push aside concerns about whether children and adolescents can consent to medical treatments that WPATH members privately acknowledge often have devastating and permanent side effects, end quote. Now, this is a very, very big story that at the time of recording of this show was getting no attention from the mainstream media here in Australia. Conversations from a WPATH internal messaging board and a video of an identity evolution workshop panel show WPATH members discussing permitting, quote, vaginoplasty, a surgery that removes the penis, testicles and scrotum and repositions tissue to create a non-functioning pseudo-vagina on a 14-year-old boy so he could present as a girl. Marcy Bowers, a man who identifies as a woman, is WPATH's president and a California-based pelvic and gynecologic surgeon. Now, Bowers says any age limit for gender treatment is arbitrary, and 2022 WPATH guidelines dropped a chapter on ethics, of course they did, and abolished age limits for starting children on hormones and performing surgery. Now, in the leaked WPATH internal discussion forum, Bowers described the best time for a child to have irreversible gender reassignment surgery. And I quote, sometime before the end of high school does make some sense in that they are under the watch of parents in the home they grow up in, Marcy Bowers wrote. Now, Christine McGinn is another WPATH member who is also a man identifying as a woman and a Pennsylvania plastic surgeon. He agreed with Bowers. The New York Post reported that McGinn has performed about 20 vaginoplasties in patients under 18 and thinks the, quote, ideal time in the US is surgery the summer before the last year of high school. The summer before the last year of high school. I've heard many other surgeons echo this, Christine McGinn said in the WPATH leaked documents. Now, these documents show surgeons make pseudo-vaginas for boys by harvesting part of their intestine, but admit the surgery can lead to problematic surgical outcomes because the tissue is too immature. This is shocking stuff. According to the New York Post, Bowers has performed 2,000 vaginoplasties with his highest profile patient 17-year-old Jazz Jennings, the transgender star of the reality TV show I Am Jazz. The New York Post reported, quote, at other stages, members talk frankly about the complications for the transition surgery for girls, a phalloplasty in which a non-functioning pseudo-penis is fashioned from either the forearm or thigh tissue. It requires a full hysterectomy and surgical removal of the vagina. They also discuss other serious consequences, including pelvic inflammatory disease, vaginal atrophy, abnormal pap tests, and incontinence. A 16-year-old girl who had been on puberty blockers for several years before she was put on testosterone for a year had developed 2 liver tumours that an oncologist concluded the hormones had caused. Another member described a young patient on testosterone for 3 years who had developed vaginal pelvic pain, spotting, atrophy with persistent yellow discharge. Several colleagues described patients with similar conditions, some with debilitating bowel problems or bleeding and excruciating pain during sex, feeling like broken glass. Vaginal estrogen creams and moisturisers, as well as hyaluronic acid suppositories, can be helpful, end quote. Now, Bowers is also exposed as affirming that puberty blockers were reversible, something not supported by the science. He also downplayed the consequences for transgender children to bear children in the future, saying the fertility question had no research. Now, clearly the loss of a penis or a vagina will make someone infertile. This is something that's lost on the LGBTIQA+ political activists that are running WPATH. As of today, Australia's leading child gender clinic, the Royal Children's Hospital in Melbourne, referenced WPATH guidelines on its website. Last month, the mother of a 15-year-old girl wrote online that it was a happy day when the RCH referred her daughter for a double mastectomy so she could present as a boy. You can see the consequences of the WPATH, the international body, and the effect it's having here in Australia. Now, the Victorian Health Minister, Mary-Ann Thomas, in response to questions on notice from expelled Liberal Moira Deeming, told Parliament recently that, quote, the Royal Children's Hospital does not provide or refer children to surgical treatment. Now, clearly the mother and the minister can't both be right. We know what WPATH thinks. Now, the Family First political party has long called for the closure of Australia's child gender clinics and for it to be unlawful to prescribe puberty blockers, cross-sex hormones and perform gender reassignment surgery on minors. If adults want all this, go for their life, although I don't recommend it. But certainly children should be protected from this and our politicians should be protecting them. This is probably the world's biggest medical scandal. It's happening here in Australia as well, and our political leaders are silent.